Hello and welcome to the Mental Health Awareness video series. My name is Dr. Lynette Hillsberg and I am a counsellor. The subject of mental health is rarely discussed. Knowing what can control or change our mental health is important. We need to understand why we feel different and how the choices in our lives can affect our overall mental state. These videos are aimed to help open the conversation to bring awareness of this sensitive topic and encourage people to reach out for support if needed. The information will benefit the deaf, hard of hearing, vision impaired and hearing communities because the information is given in sign, voice and closed captions. As Auslan is my second language and out of respect to the community, I feel it's important that I have a deaf person sign on my behalf while I do voiceover. I would like to introduce James as the interviewer and Trisha as my deaf person who have agreed to help me raise awareness around this sensitive topic. I'd also like to acknowledge the traditional custodians of this land and pay our respects to the elders past, present and future, for they hold the memories, traditions, culture and hopes of Aboriginal Australia.
Hello and welcome. Today we are talking about a common mental health condition, specifically one that affects people where they are feeling sad or unhappy. Often these people are assessed by a doctor or mental health practitioner and diagnosed with depression. With me today, I have Dr. Lynette Hillsberg, who will explain what this means. Welcome, Lynette. Thanks for chatting.
Thanks, James. It's a pleasure to be here.
So can you tell me about feeling sad or unhappy? And is this something to be concerned about?
Well, being unhappy and feeling sad when faced with stress such as loss, disappointment or frustration, that's a normal reaction. And that usually lasts for a short time. It's part of everyday experience, not regarded as depression in a psychiatric sense.
So what is depression?
A sad or depressed mood is not to be confused with a major depressive disorder, which is one of several forms of clinical depression. And this is a serious medical condition. Although sadness is frequently a presenting sign of depression, not all patients complain of sadness, and many sad patients do not have major depression.
What do you mean by several forms?
Well, depression is a group of conditions, and that ranges from an understandable reaction to stress, such as loss or death of a loved one, to serious depressive illness. It may follow on from a stressful period, or it may develop without an apparent cause and is due to a biological illness.
Is it because the person isn't strong enough to deal with this?
Yeah, that's quite a common thought. It's often viewed as a character defect or lack of willpower. And because of this attitude, the person must endure the additional burden of having an illness that society views as a personal weakness or fault. And this can result in suffering inappropriate guilt.
Oh, that seems unfair. What does a person feel when they're depressed?
Well, a person with major depressive disorder can also suffer intense mental, emotional, physical anguish and substantial disability. This disrupts family, job and social functioning. It can also worsen the prognosis for other general and medical illnesses. And the worst consequence, if left untreated, is suicide.
That sounds really bad. So how does a person know if they're depressed?
Well, sometimes another illness may hide the fact that the person is depressed, or the illness itself may be a contributing factor. It's important that a doctor carries out a full physical checkup as part of the assessment of depression.
So does a person have any physical symptoms with depression?
Yeah, there's some common complaints, and these include pain, including headache, abdominal pain, and other general body aches, low energy, which is excessive tiredness, lack of energy or reduced enjoyment in doing things. You're feeling apathetic, irritable, anxious. Sexual complaints sometimes, problems with sexual functioning or desire.
It's quite broad. I get these symptoms sometimes. Does this mean I'm depressed? Are there any other clues?
Additional clues would be the prior episodes of depression, if you've had that before, family history of major depressive or bipolar disorder, personal or family history of suicide attempts, concurrent general medical illnesses or any substance abuse that you're using, and symptoms of fatigue, despondency, irritability, or sadness. Recent stressful life events and lack of social supports.
Oh, I have a stressful life. If I'm diagnosed, does this explain why I have depression?
No, stress should not be used to explain away depression. Sometimes stress can bring on depression. In some cases.
Really? So, what causes depression? Can it be brought on by one thing, say for example, if I lost my job?
Often there's many different parts that connect to cause depression, and these can include hereditary. So the tendency to develop depression can run in families, and it's similar to developing other illnesses like heart disease or high blood pressure. There's biochemical imbalances. A major depression is thought to be due to this, and it's the chemicals in the brain, and that can be corrected with antidepressant medications. You've got stress, and this is more common at certain stages in your life, such as menopause or childbirth, retirement, loss of employment, or major changes in your life situation. So the recent pandemic is a good example.
So, family, chemical imbalance, and stress can cause depression. Are there any more?
Yeah, there's a couple more. Some personality types are more prone to depression, and these are perfectionists who set really high standards for themselves. Others who find it difficult to adjust to change, and those who are really dependent in a relationship when they break up with that person. There's also learned response, and in some cases the person's exposed to repeated loss of stressor forms, belief pattern that life's difficult, understandably feels helpless and depressed.
Okay. So, say if I feel that I'm depressed, how do I get diagnosed?
Well, first it's important to go and see your doctor, and they'll ask you some questions. And you need to have specific symptoms that they look for to figure out what level of depression that you have.
Oh. So, how many levels are there? I thought depression was just depression.
Yeah, a lot of people think that. Well, there are 3 levels. The first is severe depression, and somebody nearly has all the symptoms of depression. And this always keeps them from doing their regular day-to-day activities. The second one is moderate depression, when the person has many symptoms of depression and that often keeps them from doing things that they need to do. And the third is mild depression, and this person has some of the symptoms and it takes extra effort to do the things that they need to do.
So, what are the symptoms? You mentioned before pain, anxiety, and being tired. Is this right?
Yeah, in a sense. For major depression, you've got to have at least 5 symptoms happening at the same time, including depressed mood, being unhappy in your life with 2 other symptoms every day for a 2-week period.
Remind me again, what are the symptoms?
So these are significant weight loss or gain, insomnia, or the opposite of this, which is extreme sleepiness, fidgeting, restlessness, fatigue, loss of energy, feelings of worthlessness, and this includes guilt, decreasing concentration that can include indecisiveness and recurrent thoughts of death or suicide.
Wow, that's a lot to remember. You've talked about causes and symptoms. I'm interested if there's only one type of depression, because I know someone who had depression because they lost their job.
Yeah, that's a good question. There's quite a few types, and the one your friend had is called reactive depression, and this is where the person has stress and reacts to a distressing situation in their life, like the breakup of a close relationship or loss of a job. With reactive depression, it's more intense than the unhappiness experienced in your daily life, and it lasts longer. The symptoms often include anxiety, poor sleep, loss of appetite, and it usually goes away when the cause is removed, or when the person finds a new way to deal with that stress.
Yes, my friend got really drunk and started saying some weird things about not wanting to live.
Well, the risk of this type of depression is that if the person takes alcohol or drugs, and this can alter their thoughts and their logical thinking, they may impulsively decide, oh, it's just all too much, and attempt to end their life.
It's really sad.
Yeah, it can be.
So, are there other types of depression, and can you explain the differences?
Well, there's major or endogenous depression, and that's more severe. It can happen without any reason, or a distressing event could bring it on. It's believed to be the result of a chemical imbalance in the brain, and this can happen to people who have coped well, are good at their job, happy in their family and social relationships.
So, what happens to the person?
Well, they become low in spirit, lose enjoyment in life, have disturbed sleep pattern, normally wake early, and they lose their appetite, have weight loss or poor concentration, lose energy and feel guilty for no good reason. And sometimes they feel their life is so pointless, they think about and plan their death.
So, are there other types that come from this chemical imbalance?
Yeah, there's manic depression, and that's part of bipolar disorder. And the person has periods of major depression. This alternates with periods of mania involving extreme happiness, rapid speech, overspending, and in more serious cases, delusions of grandeur.
That sounds serious. Is this the worst kind?
No, the other one is psychotic depression. It's the most serious form of depression. The person loses touch with reality, can stop eating or drinking. They possibly hear voices saying that they're wicked and they deserve to be punished. Some can develop false beliefs, and these are called delusions. The person believes they have committed bad deeds in the past and they deserve to be punished. And in cases like this, the Person loses touch with reality, needs hospitalisation and psychiatric treatment, and that's urgently needed.
So, are there clear boundaries when someone has depression?
Now, it's important to know that it's often impossible to distinguish between the various types of depression, and there's often a good deal of overlap, and that's why the person must see the doctor for the diagnosis.
So, how do we go about helping someone who is depressed?
Understanding from family and friends is really important. It's no use saying to a depressed person, oh, just pull yourself together. This sort of advice from well-meaning friends may make the person feel even more hopeless. It's better to provide encouragement and support so the person can ask for help without feeling like a failure.
Well, that makes sense. So, what are the treatments that you can get from the doctor?
The type of treatment depends on the type of depression and how severe it is. Major depression is a medical condition and can be successfully treated. Sometimes a person may need a combination of treatments, and these are education on how to deal with the symptoms, taking medication, attending professional counselling, or if it's really serious, spending some time in the hospital for more intensive treatment.
With all these treatments, does the person recover from this or is it ongoing?
Yeah, the person can recover, but the risk of this happening again is quite significant. There's 50% after one episode, 70% after 2 episodes, and 90% after 3 episodes.
Wow, this has been really informative. Is there anything more I need to know about depression?
Yeah, it's important to know that depression is a medical illness, not a character defect or weakness. Recovery is the rule, not the exception, and treatments are effective and there are many options. An effective treatment can be found for almost everyone. The aim of the treatment is to completely stop all symptoms, not just getting better, but getting and staying well. And the person and family should be alert to early signs and symptoms and seek treatment straight away if the depression returns.
Well, this has been really interesting learning about the different aspects of this illness. Thank you, Lynette, and I look forward to chatting to you again about mental health issues.
Thanks, James. Been lovely to chat with you as well, and I hope the information has helped understanding depression a little bit more.